Trigger points in 5 different muscles can refer pain to the knee. Those that refer to the back of the knee include first the hamstrings, represented here in yellow, which can also cause back of the thigh pain. The gastrocs, shown here in purple, which can cause both medial and lateral knee pain on the back side. In green, we have the Vastus lateralis trigger points, which can refer pain to the lateral thigh and the lateral knee. And in blue, we have the Rectus femoris trigger point, which refers pain to the anterior knee and deep inside the joint. And lastly, in red, we have the Vastus medialis trigger points, which can refer pain to the medial thigh and the medial anterior knee. Clinical findings for the hamstring trigger points. Clients with active trigger points in the hamstring muscle group will typically complain of pain in the posterior thigh and knee that gets worse when walking and could cause a limp. They may also complain of pain in the buttocks, in the back of the thigh and the knee while they're sitting. The pain usually disturbs their sleep, and sometimes they can complain of quadriceps femoris symptoms like knee pain and upper thigh pain due to the prominent antagonistic relationship between these muscle groups. Some activating factors for hamstring trigger points include physical compression of the trigger points by sitting in a poorly fitted chair, as if the chair is too high and actually compresses the trigger points. Bending at the waist for a sustained period of time. And sitting with your legs crossed for long periods of time. Here are the clinical findings for the gastrocnemius trigger points. Dr. Travell refers to this muscle as the calf cramp muscle, so most clients will complain of nocturnal calf cramping and pain in the calf, the back of the knee, and the instep part of the foot. Some activating factors for gastrocnemius trigger points include chilling the muscle, walking or jogging up a steep slope or uneven surface, walking or jogging in sand, prolonged immobilization by a walking cast after an injury, tight-fitting socks or garters, wearing high heels, plantar flexion of the foot during sleep, S1 radiculopathy, and a vitamin E deficiency that causes cramps. Clinical findings for the Vastus lateralis trigger points. Dr. Travell refers to this muscle as the stuck patella muscle because the patella may lock in place or be limited in movement. Clients will complain of pain along the lateral aspect of the thigh and the knee, and the pain is usually aggravated by walking. Activating and perpetuating factors for these trigger points include sudden hard contraction to brace from a slip, a fall, or a jump, deep knee bend exercises, excessive hamstring tension, sitting with one leg tucked under the buttocks, skiing accidents, and impact trauma. Clinical findings for the rectus femoris muscle. Dr. Travell refers to this muscle as the two-jointed puzzler because it's the only quadricep muscle that crosses both the hip and the knee joints. Clients will complain of knee and lower thigh pain, and they may also complain of a severe, deep aching pain at night. as well as a buckling hip. Some factors that may activate or perpetuate trigger points in the rectus femoris muscle include sitting with a heavy weight on the lap, such as a child, previous hip surgery, and sudden falls. Clinical findings for the vastus medialis trigger points. Dr. Travell refers to this muscle as the buckling knee muscle. Clients will complain of a toothache type pain deep in the knee joint. As their pain subsides, the muscle can develop sudden episodes of weakness, causing unexpected knee buckling while they're walking, especially up or downstairs. The term trick knee usually implies active trigger points in the vastus medialis muscle. Activating and perpetuating factors for these trigger points include excessive pronation of the foot, strenuous athletic activity such as football, soccer, and basketball, prolonged kneeling on the ground such as when gardening, sudden hard contraction of the muscle to brace themselves from a slip, fall, or a jump, deep knee bend exercises, excessive hamstring tightness, sitting with one leg tucked under the buttocks, skiing accidents, and impact trauma.